Good afternoon. I call to order the meeting of the Assembly Health Committee of June 30th. Want to make a couple quick announcements, and I see we have an author here, so we'll be commencing shortly with our first bill. Regarding time limits, we will hear 2 witnesses per side with a time limit of 3 minutes each. Additional witnesses after that, please state only your name and organization, and for the record, your position on the measure. On the consent calendar, we have the following bills proposed for consent. Item number 2, SB 296, Senator Cannella, and item number 3, SB 299, Senator Monning. Today, honored to have with us a substitute member, Assembly Member Kevin McCarty, who will replace Assembly Member Santiago for today's hearing only. And we're going to start as a subcommittee, as we don't have a quorum yet. So we can't entertain any motions until we have a quorum. We should do that later. And we're going to start with agenda item number 1, SB 149, Senator Stone, investigational drugs, biological products, or devices, right to try. Mr. Senator, whenever you're ready.
Chairman, honorable committee members, I'm very honored to be here today to present SB 149. First off, I would like to take all 3 suggested amendments in the committee analysis as author amendments and thank the committee staff for their work on this bill. SB 149, also known as the Right to Try Act, is a unique bill that will provide hope to terminally ill patients in the state of California. Patients who are terminally ill often have very few options available for them. For terminally ill patients who have exhausted all their conventional treatment options, obtaining access to potentially life-saving investigational drugs is often extremely difficult. For these patients, their only hope for obtaining these potentially life-saving drugs is to request the FDA grant them expanded access. Unfortunately, the process for expanded access is confusing and time-consuming. There's an estimated 100 hours worth of paperwork to fill out with the FDA, and then it may take the FDA up to a month to make a final decision. We feel that there's a better way. Under SB 149, a terminally ill patient can request to try an experimental drug that has passed phase 1 trials as a last chance to save their life. This can only happen under a very specific set of rules. 1, the patient has a terminal illness and has exhausted all conventional treatment options. 2, the patient's doctor has advised the use of an investigational drug. And 3, the investigational drug has successfully completed basic safety testing. 4, the patient has provided an informed consent. And 5, the company sponsoring the development of the investigational drug is willing to make it available to the patient. The bill contains important protections for all parties so that the doctor and hospital advising the drug and the pharmaceutical company providing the drug would not be subject to a lawsuit. This bill will save lives. It passed out of the Senate 39-0. With me today is Kurt Altman with the Goldwater Institute, who is here to testify in support of this bill, and I respectively ask for your aye vote.
Thank you, Mr. Senator. Whenever you're ready, witnesses in support.
Mr. Chairman, members of the committee, thank you, and thanks Senator Stone for the invitation to testify before this committee. I again would urge this committee to vote for an aye vote on this bill. I am the National Director of National Affairs and Special Counsel for the Goldwater Institute. Again, my name is Kurt Altman, and I was one of the original drafters of model legislation that Right to Try, SB 149, and many of the bills around the country are roughly modeled after. I've spoken to this committee before, reference this subject, and just as an update, since I was here previously a couple months ago, Right to Try laws are now signed into law in 21 states around the nation and sitting on the desk of the governors of both Illinois and North Carolina. So it is passed currently in 23 states. I'm not going to take a lot of time. I've been in most of those states that have passed the bill. I'm able to answer questions about the FDA process, why Right to Try laws are needed, how they work, and how they're designed to work in conjunction with clinical trials as opposed to against. So I will offer myself up to this committee for any questions they may have. And other than that, again, thank you for having me here, and I urge your aye vote. Thank you.
Thank you. Before we go to the next witness, seeing a quorum, Madam Secretary, please call the roll.
Bonta,
Here.
Mainshine, Bonilla, Burke, Chavez, Chu, Gomez, Gonzalez, Hernandez, Blackie, Nazarian, Patterson, Ridley Thomas, Rodriguez, Santiago, I'm sorry, McCarty, Steinnorth, Thurman, Waldron, Wood,
Thank you. We have a quorum. I wanted to establish that. Next witness in support.
Thank you, Mr. Chairman. David Jones on behalf of the City of Murrieta. We think this is a very well thought out. It's got good compassion, gives hope when it's most needed, and we think that this is great policy. Thank the author for bringing it forward. We ask for an aye vote.
Thank you. Additional witnesses in support. Witnesses in opposition.
Thank you, Mr. Chair and members. Amy Durbin with the California Medical Association. Unfortunately, here in opposition to the bill, but have had many good conversations with the author's office and appreciate the acceptance of the committee amendments today, and look forward to continuing our ongoing discussions to address our remaining concerns at this point. Thank you.
Thank you. Additional witnesses in opposition. Seeing none, questions or comments from members? Assemblymember Burke.
So this would be for you, I think, to start. I actually have a friend who passed away last night because he was on the side of, he didn't get the drugs, right? So everyone else lived in the study, and he was on the side that got the placebo. And so my question is, right now, is how effective have right to try legislation, how effective has it been in actually getting the drugs into people's hands? I know we've seen a similar bill earlier this year with the Assemblyman Calderon. So that's my first question. And my second question, to use your words, Senator Stone, is how do we encourage drug companies to be willing to make these drugs more available for those people who, after these studies are over, to get the drugs is too late. They're dying by that point.
Mr. Chairman, Assemblymember Burke, as far as how, I guess you were asking how many times this has been used so far. Currently, in the 21 states that have passed the bill, there are only 6 states where the law is in effect. The law has not been implemented. It hasn't been used by a patient in any of those states yet, but I can tell you and this committee that there are a number of states where preparations are being made, and it's my expectation that the certain drugs will be getting into patients' or doctors' hands and available to patients by the end of the summer, both in Texas, in the state of Texas, whose law just became effective. The state of Louisiana and Arizona are 3 as an example. But as I sit here today, can I tell you that any patient has received the drug? They haven't. But it is relatively new, and like I said, only in effect in 6 of the 21 states.
Thank you, Assemblywoman. I think there are 3 issues with respect to trying to getting these investigational drugs out to people that can use them as a last source. And by the way, I'm a pharmacist by profession, so I've had patients that have come into my office that have exhausted all their remedies to sometimes even travel to other countries to get drugs that are being investigated in our country but are actually approved in other countries. So I think the most principled one is liability. These drug companies want to make sure they're not going to be sued. This bill protects them. It also doesn't want to provide a drug that may in fact jeopardize their ongoing study. And I think that if you look at the patients that would be the beneficiaries of these drugs, they're usually people that have advanced disease, where most of these studies start with people that have been initially diagnosed, so they can really follow the progress of the drug. And then secondarily, most of your drug companies are driven by 2 issues. They're driven by humanitarian issues, and they're driven by profit, as most of these drug companies are publicly owned. And I think there is a humanitarian side to many of them that will hopefully step up to the plate with these protections. They're not mandated to do so. It's they have to be willing to provide the drug. But I think that many of them will intervene in a situation where somebody has reached their last straw, if you will.
Right. I hope so. Thank you.
Thank you.
Additional questions or comments from members of the committee? We can entertain a motion. We have a motion. We have a second. Senator Stone, would you like to close?
Thank you, Mr. Chairman. I appreciate your consideration. I urge an aye vote.
Thank you. We have a motion. We have a second. The motion is due pass to B&P Committee, and just confirming and clarifying that the amendments will be taken in B&P Committee. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Bonilla? Burke? Burke, aye. Chavez? Chu? Chu, aye. Gomez? Gonzalez? Hernandez? Lackey? Aye. Lackey, aye. Nazarian? Patterson? Patterson, aye. Ridley Thomas? Rodriguez? Aye. Rodriguez, aye. McCarty? Aye. McCarty, aye. Steinnorth? Aye. Steinnorth, aye. Thurmond? Aye. Thurmond, aye. Waldron? Aye. Waldron, aye. Wood? Aye. Wood, aye. 11-0.
The bill passes with a vote of 11-0.
Thank you, Mr. Chairman, honorable colleagues. Thank you so much.
Thank you, Senator Stone. I see Senator Monning. We'll go to item number 4, SB 315. Senator Monning, as he's coming up, we can consider the consent calendar. The committee can entertain a motion. We have a motion. We have a second. Madam Secretary, please call the roll on the consent calendar.
Bonta?
Aye.
Bonta, aye. Mainshine? Bonilla? Burke? Chavez? Chu? Chu, aye. Gomez? Gonzalez? Hernandez? Lackey? Aye. Lackey, aye. Nazarian? Patterson? Patterson, aye. Ridley Thomas? Rodriguez? Aye. Rodriguez, aye. McCarty? Aye. McCarty, aye. Steinnorth? Aye. Steinnorth, aye. Thurmond? Aye. Thurmond, aye. Waldron? Waldron, aye. Wood? Aye. Wood, aye. I'm here, aye. Burke, aye. 11-0.
The consent calendar passes with a vote of 11-0. Senator Monning, whenever you're ready.
Thank you. Good afternoon, Mr. Chair and members. Senate Bill 315 authorizes the California Health Facilities Financing Authority, CHAFA, to transfer up to $1.5 million from its Hospital Equipment Loan Program Fund for use in a second California Health Access Model Program, or CHAMP-2, competitive grant selection process. If the demonstration projects receiving the CHAMP grant are deemed successful, then SB 315 would additionally authorize up to $5 million to award grants statewide to replicate and implement innovative models. Any authorized but unused grant funds as of January 1st, 2023 will revert back to the original fund. The first CHAMP grant has had preliminary success and sparked other innovative ways to promote innovative healthcare delivery for vulnerable populations. This bill seeks to build from that success with a second round of CHAMP grants from the CHAFA funds that have accumulated due to loan repayments and building interest. The second round of CHAMP grants that SB 315 will enable have the potential to increase health access, improve clinical outcomes, and achieve cost savings in the healthcare system. Members sponsoring this bill and here to testify in support, Nick Gulino on behalf of the California State Treasurer, and followed by Bianca Smith with CHAFA, who will provide any technical information. With the Chair's permission, I'd like to present those witnesses. Thank you.
Whenever you're ready.
Thank you. Good afternoon, Chair and members. My name is Nick Galino. I'm here on behalf of State Treasurer John Chung, who is the sponsor of SB 315. In 2012, the legislature spurred innovative and cost-effective healthcare services for the benefit of the state's vulnerable healthcare populations through the California Health Access Model Program, or CHAMP. SB 315 allows CHAFA to build upon the successes of this program through the creation of CHAMP 2. Based on the achievements of the original program, CHAMP 2 will continue to find creative and innovative ways to improve health access and cost containment objectives to meet the growing healthcare needs of our most vulnerable populations. We appreciate your consideration of SB 315, and Bianca Smith from CHAFA is here to handle any technical questions that may arise.
Thank you. Next witness in support.
Sorry?
You're for questions only. Thank you. Additional witnesses in support. See none. Any witnesses in opposition? See none. Questions or comments from members of the committee? We have a motion. We have a second. Senator Monty, would you like to close?
Just respectfully ask for your aye vote. Thank you for your consideration.
Thank you, Senator Monty. The motion is due pass to appropriations. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Bonilla? Burke? Burke, aye. Chavez? Chu? Aye. Chu, aye. Gomez? Gonzalez? Hernandez? Lackey? Aye. Lackey, aye. Nazarian? Patterson? Aye. Patterson, aye. Ridley Thomas? Rodriguez? Aye. Rodriguez, aye. McCarty? Aye. McCarty, aye. Steinnorth? Aye. Steinnorth, aye. Thurmond? Aye. Thurmond, aye. Waldron? Aye. Waldron, aye. Wood? Aye. Wood, aye.
The bill passes with a vote of 11-0.
Great. Thank you, Mr. Chair, members.
Thank you, Senator Monty.
Thank you.
No bell, right? I see Senator Mitchell. We'll go to our next item, item number 6, SB 388. Senator Mitchell.
Good afternoon, Mr. Chair
Good afternoon.
and Health Committee members and staff. Hello. I used to be a member here, you know. I'd like to thank you very much for the opportunity to present to you Senate Bill 388. Let me begin by accepting the committee's amendment on page 9 of the analysis, actually both of the amendments on page 9 of the analysis. The first one clarifies the implementation date for the health plans to be October 15th, 2016. It'll provide them enough time to translate the document and just in the nick of time for fall open enrollment. And secondly, we'll be accepting the technical amendment, which was a drafting error also reflected on page 9 of the analysis. The Summary of Benefits and Coverage, or SBC, details what is covered under a health plan, explains coverage limitations, and provides definitions of key terms to consumers to help them evaluate and compare their health insurance options. It's also required under the Affordable Care Act and state law. SB 388 will require that the SBC document is made available in critical threshold languages by geographic area and clarifies that the SBC must be translated in languages that reflect California's demographics. Unfortunately, because of a technicality in federal law, translations are only available in 4 languages: Spanish, Chinese, Navajo, and Tagalog. As California is a diverse state, our state's translation requirements will vary. For example, 25 of California's 58 counties meet the necessary federal requirements for the SBC to be translated into Spanish. However, there is no similar requirement under federal law to translate other threshold languages that we have here in California. This leaves many communities in our state without access to this critical information upon which they make their health care decisions. This bill will help ensure that all plans adhere to California's language access laws. I've got several witnesses here to testify in support of the bill. We'll begin by hearing from Kimberly Chin from CPEN and Catherine New, who's with the Southeast Asian Resource Action Center, and I ask for your favorable consideration.
Thank you. Witnesses in support.
Kimberly Chen with the California Pan-Ethnic Health Network, proud sponsors of SB 388. And as Senator Mitchell just noted, the SBC is a consumer education document to help people easily compare health plan options. But federal requirements for making this document available in non-English languages doesn't meet California's needs or its long-standing language access requirements. And as you know, without an understanding of how health insurance works or what it covers, you're very limited in your ability to select the most appropriate plan for your health needs and essentially to effectively use your coverage. For example, we've heard from LEP consumers who do not fully understand the ramifications of selecting a small provider network plan at the lowest premium, expressed frustration at the inability to access out-of-network specialty care or finding a culturally or linguistically appropriate provider. And a lot of this can stem from their inability to understand what their coverage entails. So what this bill does is ensures that the SBC is translated and provided to LEP consumers in California's threshold languages. The department's DMHC and CDI will provide template translations in the Medi-Cal threshold languages, encouraging consistent translations of these terms. For these reasons, we're very happy to be supporting this bill and ask for your aye vote.
Thank you. Next witness in support.
Good afternoon, Mr. Chair and members. My name is Kat New, and I serve as the Vice Chair of the Southeast Asia Resource Action Center, and we're pleased to be here in support of SB 388. CRAC advocates on behalf of almost 1 million Southeast Asian Americans in California, which includes refugee communities from Cambodia, Laos, and Vietnam. The rate of limited English proficient individuals within these communities is double that of the overall California LEP population, and therefore language access is a significant barrier in obtaining health care. To help illustrate this, I'd like to give you a couple of examples from our statewide network of community health partners. First, it takes almost 2 hours for our health partners to introduce and translate health concepts and terms to one individual. This means that in an 8-hour workday, a health navigator can only help about 4 individuals. Second, many terms do not have a direct Southeast Asian language translation. One English word can become 5 words in the Cambodian language, and the translations may vary depending on the navigator. For example, co-payment may be translated to Jumnai Loi Junbi Kapao, which literally means your share of money coming out of your pocket. Or it could be Loi Jumnai Thro Bong, which translates to the money part we have to pay. SB 388 ensures that all Californians have equal access to critical health care information. We thank the author for introducing this bill, and we urge your support.
Mr. Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty. We were the original co-sponsor with CPEN of SB 853 and would be very pleased to see the SBC added to the vital documents that must be translated. Thank you.
Thank you.
Beth Capel on behalf of Health Access California, also in support.
Additional witnesses in support?
Oh, okay. Chair and members, Autumn Ogden with the American Cancer Society Cancer Action Network, also in proud support. Thank you.
Beth.
Rocio Gonzalez on behalf of the Latino Coalition for Healthy California in support.
Thank you. Witnesses in opposition or others in opposition? See none. We have a motion. We have a second. Assemblymember Chu.
I was just about to say that. I just want to thank the Senator for moving forward language access in this incredibly important context, and happy to join the chorus in moving this forward.
Thank you, sir.
Additional questions or comments from members? Seeing none, we have a motion. We have a second. Senator Mitchell, would you like to close?
I ask for your aye vote.
Thank you, Senator Mitchell. The motion is do pass as amended to appropriations. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Bonilla? Bonilla, aye. Burke? Burke, aye. Chavez? Chu?
Aye.
Chu, aye. Gomez? Gonzalez? Hernandez? Lackey?
Aye.
Lackey, aye. Nazarian? Patterson? Patterson, aye. Ridley Thomas? Rodriguez? Rodriguez, aye. McCarty? Aye. McCarty, aye. Steinnorth? Aye. Steinnorth, aye. Thurmond? Aye. Thurmond, aye. Waldron? Aye. Waldron, aye. Wood? Aye. Wood, aye. 12-0.
The bill passes with a vote of 12-0.
Thank you, sir. Thank you, committee members.
Thank you, Senator Mitchell. Okay, we're currently awaiting an author. For staff that are following along on the video feed, if you have a senator who's an author and can encourage them to come present in Health Committee, that would be much appreciated. We have 2 authors on their way who will be here shortly. Senator Mendoza, we have item number 9, SB 792. Whenever you're ready.
Thank you, Mr. Chair. Members, I'm here to present SB 792. First, I would like to accept all the committee amendments outlined on page 7 of the analysis. I appreciate this, the help that your committee has provided to our office. SB 792 protects young, vulnerable children by making sure that those who care for them in child care settings are vaccinated against serious contagious illnesses. While diseases like the measles may seem like a minor inconvenience to you and I, it can be deadly for young children. Numerous expert bodies, including the CDC and the California Department of Public Health, recommend that those who care for young children receive a measles shot and other important immunizations. Until they are fully vaccinated, children rely on those around them to maintain a community of immunity. This bill will affect employees at daycare centers and family daycare homes and was carefully crafted to place these requirements within existing laws governing daycare centers. All the vaccines required by this bill are covered in full at no cost to the employee by insurance policies and Medi-Cal. Uninsured employees can find no to low-cost vaccines at their local health department. Employees can obtain medical exemption from their physician if they cannot be vaccinated or if they can show that they have already been immunized. The immunization records will be reviewed during the regular licensing inspections, along with other required records such as TB screening tests. We work to make sure the bill is minimally burdensome to providers, including recently amending the bill to scale back the required vaccinations. With me today to testify, we have Dr. Robert Kim Farley with the Los Angeles County Department of Public Health. We also have Shayla Williams on behalf of Kinder Care. I respectfully ask for your aye vote, Mr. Chair.
Thank you, Mr. Senator. Witnesses in support.
Good afternoon, Mr. Chair and members. I am Dr. Robert Kim Farley, and I'm testifying on behalf of the Health Officers Association of California and also representing Los Angeles County. By way of my background, I am Director of Communicable Disease and Control for the Los Angeles County Department of Public Health. Every day, parents throughout California entrust the staff of daycare centers to keep their infants and children safe. By requiring child care staff to be vaccinated, we can help prevent the transmission of vaccine-preventable diseases to these children. SB 792 has been narrowly focused to require staff of daycare centers to be fully vaccinated against 3 highly contagious yet preventable diseases: measles, pertussis, and influenza. This vaccination protects infants and young children who are too young to be immunized or fully immunized, are more likely to be susceptible to these contagious diseases, and more likely to develop serious or life-threatening complications should they become ill. In 2014 in California, over 450 people were hospitalized due to pertussis, 2/3 of whom were infants under 4 months of age, and sadly, 5 of these infants died. Measles, pertussis, and influenza are easily spread in the daycare environment. For example, there's a 90% chance of being infected if an unvaccinated person is in close contact with a measles case. In addition, all 3 diseases are transmissible before a person even shows symptoms. It is also important to point out that the environments of daycare centers are vastly different than the environments of healthcare facilities. Hospitals and clinics are required by laws and regulations to have a variety of highly sophisticated infection control programs in place to help prevent the spread of diseases, not only for the patient's safety, but for hospital personnel as well. Daycare centers, no matter how clean, do not have these same precautions in place, nor should they. But vaccinating daycare staff against measles, pertussis, and influenza can help stop the spread of those diseases to their fellow workers and, most importantly, to the infants and children in their care. Finally, I want to emphasize that SB 792 allows physicians to use their best judgment when recommending vaccines for their patients. Daycare workers who have medical contraindications to any of these vaccines would not be required to receive them. For example, daycare workers who are pregnant or who plan to become pregnant would not be required to receive the measles vaccine, which is contraindicated during pregnancy. Throughout the decades, it has been scientifically proven that vaccines are safe, effective, and the best way to prevent diseases. Yet many adults forego vaccines which can be beneficial not only for their health, but for those around them. Having served as the director of the World Health Organization's Global Program on Immunization, and personally witnessing the tragic consequences when children are unvaccinated against preventable diseases, I urge you an aye vote on SB 792 to protect the health and infants of young children and daycare centers. Thank you.
Thank you. Just to clarify, do you have 3 witnesses or 2 making substantive remarks in support? Thank you. 2.
Chair Bonta and members of the Assembly Health Committee, my name is Shayla Williams, and I'm a Center Director for KinderCare in Elk Grove, California. Thank you for the opportunity to come before you today in support of Senate Bill 792. KinderCare is a brand of Knowledge Universe, which has been serving children and families for over 40 years. Our brand includes the Children's Creative Learning Centers, our employer-sponsored child development centers, and champions. We have 181 community-based centers across the state of California, employing more than 3,700 teachers and staff. As you are all well aware, earlier this year, the U.S. experienced a multi-state outbreak of measles, with 178 cases documented between January 1st and March 27th this year. Infants who are too young to have received their first MMR vaccination are especially vulnerable to contracting measles. At one child care center alone this year, 12 infants became sick with the measles, as this highly contagious illness spread from one infant to all other infants in the center. Given the close contact between child and caregiver and the vulnerable population child care providers serve, it seems prudent that child care workers be immunized, much like our counterparts in healthcare who work in close contact with vulnerable populations, such as infants. We at Knowledge Universe have recently instituted a policy requiring staff to be vaccinated for measles and have restricted access to our infant rooms to individuals who have been vaccinated and parents only. We have instituted this policy in all 39 states in which we operate and in the District of Columbia. We believe Senate Bill 792 will go a long way in protecting infants who are too young to be vaccinated from contracting vaccine-preventable diseases. We urge you to pass this important legislation.
Thank you. Additional witnesses in support?
Kat DeBerg with the Health Officers Association of California, proud sponsors, urging your support.
Thank you. Additional witnesses in support?
Yes. Chair and members, Sean South on behalf of the California Primary Care Association in support.
Betsy Armstrong with the County Health Executives Association in strong support. Thanks.
Ron Rapp on behalf of the California Federation of Teachers in support.
Rebecca Gonzalez, National Association of Social Workers, California chapter in support.
Alex Hawthorne on behalf of Children Now in support.
Justin Garrett with the March of Dimes in support.
Catherine Martin, Director for the California Immunization in strong support.
Alicia Sanchez, representing the California Medical Association and our 40,000 members in strong support. Thank you.
Lydia Bourne, representing the California Division of the American Academy of Pediatrics in strong support.
Tanya Robinson Taylor, representing the California Hospital Association in support.
Nicole Wortelman on behalf of the Alameda County Board of Supervisors in support.
Michael Radigan on behalf of the Board of Supervisors, Santa Clara County in support.
Dr. Donald Lyman, Academy of Preventive Medicine for the state of California in strong support.